Thank you.
So unfortunately, our next presenter could not be here in person due to some personal issues, but we've got a pre-recording. So I'm going to introduce Dr. Lervasen Pillay, who is a sports and exercise medicine specialist physician at the University of Pretoria. So the bios are on the on our website. So when you do get your link next week to the website with the presentations and the recordings, you'll be able to view his full bio. So I am going to ask the guys at the back to put the presentation on for us.
Pain is one of the most challenging symptoms to deal with in a patient. We are often dealt with patients presenting with acute and chronic pain, as well as other types of pain like post-traumatic or post-operative pain. For purposes of this product, we will only be discussing these aspects of pain. And it's important to know that lots of other medication used to treat pain, especially moderate to severe, can be associated with several side effects. When it comes to pain management, we are looking for something that can be effective, with an easy route of administration, and most importantly, safe as well. The quick onset of action is always helpful because this will avoid unnecessary overuse of the delivery mechanism and delivery medication. For purposes of this talk, we will speak about a new product on the market called Nelbane. And it conveniently allows you to give the preparations in various forms, as well as subcutaneously, intramuscularly, or intravenous route, making it easier for the physician to decide on pain control. Its quick onset of action in about 3 minutes is also very helpful, and it allows for balanced anesthesia and also balanced pain control with proper dosage regimes. Lots of scientific studies have been done on this product in comparison to other products. And for example, this is one of the examples showing that a patient with a previous C-section was administered Nelbane in order to help with balanced anesthesia and post-operative pain relief as well in a maintenance dosage. As you would see here, the induction dosages and the maintenance dosages are quite small. The onset of action is very fast, and they have a long half-life as well. Other patients with post-operative pain also require pain relief control, and one of those indications is post-operatively to give options of subcutaneous, intravenous, or intramuscular injections to help with pain control over that period of time. Get out of the hospital sooner and have better pain relief sooner. Looking at nalbuphine and its other drugs that's associated with pain relief, a study has been done to show that in those patients with chronic pain, when nalbuphine is used instead of drugs like sufentanil, your management of pain is much better. Patients have a much better relief of pain at rest, as well as when moving off from rest into a shifted seating position. And this is very important. Other multi-centered controlled trials and randomized controlled trials, especially with this large number of participants in this study, shows that your post-operative surgical pain relief care, patients experience less side effects. And side effects we're thinking about visceral pain in management of that kind of condition is about nausea, vomiting, as well as respiratory depression. And this is quite an important fact to show its safety and efficacy in this class of patients, who is always difficult to maintain pain relief prior to sending them out of hospital. The other advantage of nalbuphine is that it is a structured synthetic equivalent to morphine or pethidine related drug. But the difference between this is that its side effects of becoming dependent on it and for narcotic abuse is very low in comparison to the previously mentioned other drugs, since it is a naloxone agonist. So this is one of the advantages of using this kind of drug, is that your chances of your patient with pain control being exposed to narcotic abuse, etc., is much. So again, what are we trying to do? We're trying to make sure that we get a good maintenance of dose, so get a titration up that helps with pain control and maintain it at that level. And then once the drug is actually stopped, we have better pain relief, and very unlikely you'll need to use long-term analgesics for the pain relief, whether it's post-traumatic or post-surgical or anything of that sort. So again, the advantages of this drug is, number one, a fast onset of action, working for a long period of time with less side effects and withdrawal symptoms. It's equipotent to your morphine derivative analgesia and less side effects like nausea, vomiting, and respiratory depression, hence giving it a very good safety profile. It's varied administrative routes, being subcutaneous, intramuscular, or intravenously, is perfectly suited for their acute pain relief. And with time, hopefully, the paramedic organizations get the HPCSA to add this drug as part and parcel of their pain management when on the road as well. So in order to find an appropriate drug, something that's cost effective, something that has a quick onset of action, and something that works well within the frames of managing acute to chronic pain, I think nalbuphine is an open option for someone to consider instead of the traditional opioid derivative drugs.